Hello, everyone. Thank you very much. So I've been waiting for this meeting for 20 years, actually. And it's not that everything's 100% understood or known, but I think we've made a lot of strides.
Trump announced Monday that the U.S. Food and Drug Administration will notify doctors that the use of Tylenol during pregnancy can be associated with a very increased risk of autism. The announcement has fueled even more debate over pregnancy and autism.
I wish it was done a long time ago. Today, we're delighted to be joined by America's top medical and public health professionals as we announce historic steps to confront the crisis of autism. Horrible, horrible crisis. I want to thank the man who brought this issue to the forefront of American politics along with me. And we actually met in my office, is it like 20 years ago, Bobby? It's probably 20 years ago in New York. I was a developer, as you probably heard, and I always had very strong feelings about autism and how it happened and where it came from. And he and I don't know, the word got out, and I wouldn't say that people were very understanding of where we were, but it's turning out that we understood a lot more than a lot of people who studied it, we think. And I say we think because I don't think they were really letting the public know what they knew. Since 2000, autism rates have surged by much more than 400%. Instead of attacking those who ask questions, everyone should be grateful for those who are trying to get the answers to this complex situation. And the first day all of these great doctors behind me were there, I told them this is what we have to find out. Because when you go from 20,000 to 10,000 and then you go to 12, you know there's something artificial. They're taking something. And by the way, I think I can say that there are certain groups of people that don't take vaccines and don't take any pills that have no autism. That have no autism. Does that tell you something? That's currently, is that a correct statement, by the way?
There are some studies that suggest that, yeah, with the Amish, for example.
The Amish, yeah, virtually. I heard none. See, Bobby wants to be very careful with what he says, and he should, but I'm not so careful with what I say. But you have certain groups. The Amish, as an example, they have essentially no autism. First, effective immediately, the FDA will be notifying physicians that the use of let's see how we say that. Acetaminophen. Is that okay? Which is basically commonly known as Tylenol, during pregnancy can be associated with a very increased risk of autism. So taking Tylenol is not good. All right, I'll say it. It's not good. For this reason, they are strongly recommending that women limit Tylenol use during pregnancy unless medically necessary. That's, for instance, in cases of extremely high fever, that you feel you can't tough it out, you can't do it. I guess there's that. It's a small number of cases, I think. But if you can't tough it out, if you can't do it, that's what you're going to have to do. You'll take a Tylenol, but it'll be very sparingly. It can be something that's very dangerous to the woman's health. In other words, a fever that's very, very dangerous, and ideally a doctor's decision, because I think you shouldn't take it.
I never took Tylenol when I was pregnant, yet my kids have autism. I guess Tylenol did not send him the protection money. Trump has set off a huge debate about the cause of autism, with many saying his remarks oversimplify a complex condition.
There was a study that came out that has preliminary research indicating that there might be a link between these two. This has been widely debunked, and we will talk about it in a minute. The word that an expert used, and I'll talk about it in a second, is not terribly compelling about this particular study. But I want to take a second and talk about a few things about autism. So autism diagnoses began going up starting in 2013 when they expanded the definition of what it means to be someone with autism. So you will see a lot of information about how there's a rise in autism. And the answer is yes, there is a rise in autism diagnoses because there's an expanded definition of what it means to have autism. So it's not to say that there are significantly more people who have autism. And I think that's the correlation that we're really missing right now in these public debates about this. It is not to say that there are, just thousands more kids being born with autism. There are environmental factors that might be interacting with genetic, underlying genetic reasons to have autism. So it may be that there are some correlations. And my understanding, I'm not a doctor, I'm just a mom and a journalist. But my understanding is that there may be some slight environmental factors that are working with underlying genetic reasons that might be triggering some autism. But in general, the reason that I think it's 1 in every 31 kids is diagnosed with autism versus 1 in 36 is because of the expanded definition of autism, okay? So to correlate this with Tylenol, as if a mom taking Tylenol is causing her kid to have autism, is really reckless and, in my opinion, really irresponsible. Pete Hegseth is sharing videos advocating for women not to be able to vote, right? Is they are taking away one of the only safe options for women to manage their pain during childcare, right? They are saying that one of the only ways that women have to reduce their fevers, we know that fevers can cause really serious conditions for women when they are pregnant, right? When a mom has a fever and the infection goes really high, it can do real damage to a baby. So this is taking away Tylenol does hurt children, right? Does hurt fetuses. So one of the things that they're doing is taking away pain management, fever management, and some other really concerning things if they're correlating Tylenol with autism, right? The other thing that I thought was really interesting is the head of the Texas vaccine program at Texas Children is also talking about how some of the things I was saying about or underlying genetic conditions, right? That it is, he is the one who's saying that it's not terribly compelling science to say that Tylenol causes autism. To say, as he says, if saying Tylenol causes autism, that would be like saying we found one thing that causes cancer and now we're going to cure cancer because we have discovered this thing. And that's just not possible. Cancer is significantly more complicated. Autism is significantly more complicated. Everything that I am reading is saying that there is no compelling reason for women under the guidance of their doctors not to have access to an over-the-counter medication that is one of the few that is recommended to be able to reduce their pain.
Tylenol, also known as acetaminophen, is one of the most widely used pain relievers and fever reducers in the world. Tylenol has long been considered a safe and reliable option for treating mild to moderate pain, including headaches and muscle aches. Unlike some other pain medications, acetaminophen is not classified as an anti-inflammatory drug, which makes it gentler on the stomach. This has contributed to its popularity, and because of its widespread usage, concerns about potential long-term effects have fueled scientific studies and many debates. This doctor says that we really don't know if Tylenol causes autism.
I'm sure you saw what was all over the news today. The question came up, does Tylenol cause autism? And the answer is, yeah, we don't know. So there were 3 main issues with the data that was presented. The first is the kind of study that was looked at. This was what was called an observational study, but it was actually groups of observational studies put together with something called a navigation guide by doctors at Mount Sinai to try to extract the best data from observational studies. Observational studies are not good ways of looking at data or looking at research because they're just looking at the past to see what happened. And you can't really tease out where the problems in those studies came, unlike what's called randomly controlled trials. Secondly, there are a lot of confounding factors that weren't looked at because these were stories from the past. For instance, if a mother is taking Tylenol during pregnancy, did she have fever? Was she sick? Was there stress? All reasons that could happen, which those by themselves may be a cause of neurodevelopmental delays or autism. The third is that they weren't looking at all the biases throughout it, because again, they're just looking at the past. So there are issues of socioeconomic groups where lower socioeconomic groups had increased neurodevelopmental delays. There were issues of siblings where there were certain people where there was a set of twins that were born where one had autism and the other one didn't. And yet one mom either took Tylenol or did not. How do you add those together? The biggest thing to say about this is when you have a study like this, you can't go out and say it's the cause. You can say, this brings up interesting points. We need to look at it more.
Researchers have conducted numerous studies attempting to examine whether prenatal exposure to Tylenol is linked to autism or other neurodevelopmental conditions. For now, the consensus in the medical community is one of caution. Pregnant women are encouraged to consult with their healthcare providers about the safest options for pain and fever management. RFK Jr., who is the US Secretary of Health, announced the department's next steps for this issue.
We have broken down the traditional silos that have long separated these agencies, and we have fast-tracked research and guidance. Historically, NIH has focused almost solely on politically safe and entirely fruitless research about the genetic drivers of autism. And that would be like studying the genetic drivers of lung cancer without looking at cigarettes. And that's what NIH has been doing for 20 years. As a result, we don't have an answer to this critical question, despite the cataclysmic impact of the epidemic on our nation's children. We are now replacing the institutional culture of politicized science and corruption with evidence-based medicine. NIH research teams are currently testing multiple hypotheses with no area off limits. We promise transparency as we uncover the potential causes and treatments, and we will notify the public regularly of our progress. Today, we are announcing two important findings from our autism work that are vital for parents to know as they make these decisions. First, HHS will act on acetaminophen. The FDA is responding to clinical and laboratory studies that suggest a potential association between acetaminophen use during pregnancy and adverse neurodevelopmental outcomes, including later diagnosis for ADHD and autism. Scientists have proposed biological mechanisms linking prenatal acetaminophen exposure to altered brain development. We have also evaluated the contrary studies that show no association. Today, the FDA will issue a physician's notice about the risk of acetaminophen during pregnancy and begin the process to initiate a safety label change.
While conservatives praised the Trump administration's announcement about autism, some health organizations have pushed back, warning that there is no conclusive scientific evidence to support their claim. The debate will certainly go on for weeks, if not months.